Our goal is always patient safety. On inpatient rehab, our patients are high risk for falls, and so we wanted to make sure that the staff understood how important it was for us to continue to encourage our patient safety issues.
We tried our best to express to our staff that this was not Big Brother coming in to watch their movements and watch their actions. It was all about stopping unassisted or unobserved falls, and our staff was very aware that those type of falls were a big problem for us.
This fall prevention technology solved the unknown. Really, it was not knowing what the patient was doing when we didn't have eyes on them. It was not knowing that they were getting out of the bed, or that they were attempting to get out of the bed, or that they had even fallen.
The single biggest workflow change after we initiated fall prevention technology was adding the initiation of the use of the sensors to every patient. With our standard operating procedure that we created, every patient that is admitted to our inpatient rehabilitation unit is on the sensor and on the system for their first 24 hours. So making sure that our nursing staff knew that every patient needed to be on the sensor as they came into the facility, and adding that to their daily workflow was the biggest change.
When we look at our patients, what types of things were we using to prevent falls? All of the same things that everyone always uses. Making rounds with patients, encouraging them to call when they need something, not getting up when they are not able to do that independently. That allows us that little bit of extra time, but with that personal connection with the patient so they know we're coming.
Having a monitor at the nurse's station helped alert us to when we needed to get up and go.
The predictive setting of our fall prevention technology uses predictive analytics to analyze a patient's movements and determine if they are exhibiting movement patterns that are consistent with that patient leaving the chair or leaving the bed.
It also gives us a little extra time. We can encourage the patient to remain in their chair or in bed until we get there to assist them.
The stirring setting is utilized whenever we need to know that a patient is waking up or just beginning the process of moving around the bed at the start of their day.
When we implemented this technology, the team quickly found out that this was worth trusting because we kept our patients off the floor.
Video only is used in our unit to keep our eyes on the patient, especially patients that might have some type of precautions, like contact precautions. It allows our nurses, our staff to be able to observe their movements and communicate with the patient without having to don PPE and go into each room.
The nurses, they were able to intervene quickly, so we saw a reduction of patients getting out of the bed, we saw a reduction of actual falls and falls with injury.
The exit-only setting sends an alert to our staff, to our nurses, or to our monitors whenever a patient actually exits the bed or a chair.
It was beneficial to have the handheld devices that even while we were in another room taking care of another patient, we could still make sure that our patients were cared for.
With the technology in place, we were able to prevent falls that were previously would have been counted as unobserved falls.
That is the type of fall that we in healthcare all fear, because we don't have our hands on the patients and aren't assisting the patient in falling and preventing injuries. And at the end of the day, we are not only trying to prevent falls, we're trying to prevent injuries with falls.
This was just an additional tool to help us with that. It did not take the place of how quickly we respond to patients' needs. Automation is great to add to what we do for patient care and for patient safety, but it does not take the place of that.
The year prior to initiating this technology, that was 70% of our falls. The first year that we used the system, it dropped to 52% of our falls. We were very excited about having that 18% drop.
If you look at the statistics and you look at the financial aspects of what it will cost if you have an injury that is catastrophic, the use of technology and the expense of the technology is far less than what an actual claim would be for a catastrophic injury.
I would tell a hospital administrator that if you have a lot of unassisted, unobserved falls, this is a great system for you.